Hello again, Dr. Mashburn, and we're going to continue our bone lab videos talking about, again, the appendicular skeleton, and in particular the pelvic girdle and the lower limb. So again, just for review to see where we are, remember your axial skeleton was your head, ribs, and backbone, your vertebral column. We've talked about the bones that make up your pectoral girdle and your upper limb. So today we're going to talk about our hip bones, or the bones of the pelvic girdle, and also the bones of the lower limb, which includes the femur, which makes up the thigh bone, and the tibia and fibula, which make up your lower leg, and then the bones of the foot. So the first thing we're going to talk about is the pelvis, and the pelvis is these three bones, the sacrum and then two hip bones, so one, two, and these two bones form your pelvis, and this is how your hip bones connect to your axial skeleton is through this joint here called the sacroiliac joint. And so, we'll circle that. The sacroiliac joint is where the hip bones connect to the sacrum and therefore hold your legs onto your body. So your femurs, your leg bones, they're going to articulate here and kind of hang down on either side. And this is going to be how you can connect your legs to your body. So these three bones, we use the term pelvis, and they will basically define the pelvic cavity. Okay, so when we talk about pelvic cavity in another video, we talk about differences between the male and the female. This is what we're talking about: the bones that form up the pelvis, and then in a female, how wide it is and how deep it is compared to the male. So you'll get a little more detail about that later on. All right, so when we talk about the hip bones, they're known as coxal bones or os coxa. And we'll go back to this slide here. So I want you to use coxal bone or os coxa, not hip bone on your test. When we talk about the os coxa, this coxal bone, just like the sternum, it was three bones that fused to form one. And so the three bones are your ilium, your ischium, and your pubis. And so your textbook has these divided in three colors. So here's your ilium here, your ischium here, and then your pubis here. So these are three bones that fuse to form this one bone. So on an exam, if I said name the bone, I'm talking about the os coxa. If I say name this part, I'm talking about the ilium, the pubis, and the ischium. If I want you to name this other stuff, I'll say feature. I'll be more specific in my question. So be sure you read the question so that you know what I'm asking. I've tried to delete things that you don't need to know from your textbook and just have the ones you do need to know for your exam on these PowerPoints. So for this, on the ilium, the feature is the iliac crest, which is going to be this ridge here. If you put your hands on your hips, what you're feeling is that iliac crest. Okay. There's a big depression called the acetabulum. That would be where your hip joint is. That would be where your femur is going to articulate there. So maybe this makes the ball and socket joint. This is called the acetabulum. So this is, again, your hip socket where you would put your femur to form the hip joint. This would be your pubis here. You have a big hole called the obturator foramen. Where the ilium comes, it kind of makes this little, it's almost like an ear. This is called the greater sciatic notch. And then you have a little spine here, and then a lesser sciatic notch. And on the ischium, on the posterior and kind of inferior side, it's a rough area called the ischial tuberosity. So those are the features of the os coxa that you need to know. I also want to go back to this slide and show you where the two hip bones come together right here. This piece of cartilage, that's that fibrocartilage that we have talked about in the past, and that forms your pubic symphysis. Okay, so where the two bones come together, held together by that cartilage, is your pubic symphysis. Now, if you look at another view of the os coxa, so this is just another view, you can see there's a rough area, and so this corresponds, I'm going to go back, to where the ilium and the sacrum come together and form that sacroiliac joint. So this rough area, this is the auricular or surface. It's also like an ear. But again, the articular surface where the sacrum is going to join, make the sacroiliac joint or your SI joint. It's going to be right there. You can see the body of the ilium. This whole thing is called the ilium. Here's your iliac crest again. You can see the greater notch and the lesser notch and the ischial spine here. You can see the obturator foramen, but from this view you can't see the acetabulum, so it's going to be on the other side. So you're looking at a medial view of this hip bone. All right. So again, make sure that you watch the YouTube videos to help you with your 3D versions, and also there's plenty of websites online that you can look at with 3D versions of the bone, and also in Practice Anatomy Lab in your study area of mastering, there are more pictures of these bones, and you can kind of look at them from more angles. All right, so I've got two pictures just to show you what it would look like on a real bone, because on a real bone you don't have those three colors, but this would be your ilium, your ischium, from about right there, and this will be the pubis. Okay, so again, you're not going to be able to see the three colors on the bone, so you need to be able to recognize those regions just on these white bones. You can see the big hole, the obturator foramen. You can see the greater sciatic notch, the lesser sciatic notch. You can see the iliac spine, and you can see the acetabulum right here. Okay, so again, you can figure out those features on an actual bone. All right, so the next bone is the bone that forms the thigh, and so that would be your femur. Okay, so this is a femur, and it's a long bone, and so you have your long diaphysis with a long shaft, and you have an epiphysis. This will be the proximal end, this will be the distal end, and I've basically left in the names of the features that you need to know. I've also got a bone here. This is called the patella, and that's what you would call your kneecap. And so the patella is your knee bone, and it's a little sesamoid bone that forms the front of your knee. So if you blow this up in your textbook, you can see how the patella fits over your femur and your tibia, which is your lower leg bone. You don't need to know any features about the patella. Now, for the femur, you need to know the head, which is this round area here. Okay, there's a little hole in the end of the head called the fovea capitis. This little thin area behind it is known as the neck. And then you have what are called trochanters. Trochanters are attachment points for muscles. And so you have big muscles in your leg, so you need big attachment points. So the superior one is called the greater trochanter. The inferior one is called the lesser trochanter. So lesser here, greater here. This will be the greater on this side, and then over here would be your lesser trochanter. All right. You also have to have articular surfaces on the bottom. So your condyles, your rocker surfaces, is where it's going to articulate with the tibia of the lower leg. So you have your medial and lateral condyle. So this is your medial, and this is your lateral. And then above that, you have the little areas above those called the epicondyle. So above the lateral condyle is your epicondyle, lateral epicondyle. Let's see, and then above your medial condyle, you have your medial epicondyle. So one of the things that you're going to need to do is figure out if you're looking at the front or back of these bones. And the femur is actually pretty easy. You look for this large crack. And so if you see the crack, this large depression, you're looking at a posterior view. If you can see this large depression, that's the posterior view of the bone. Well, you know that the head of the femur has got to fit into your hip. So that would tell you that this is going to be the medial side and this is the lateral side. So if you're trying to figure out if you're looking at the bone from the front or back on the femur, find this large depression here, find the head of the femur, and that will allow you to figure out the medial versus lateral side. The medial side is always going to be the same side that has the head. Okay, and again, the videos with Miss Graham will help you clarify that as she holds them up and turns them around for you and shows you both sides. So here's another femur just to show you what it would look like on a bone. Here would be your distal end. This is your proximal end. This would be the head, greater trochanter, lesser trochanter. Again, the head here. The fovea capitis is going to be a little depression right here. Greater trochanter, lesser trochanter. You have your diaphysis or your shaft, and then you have your condyles here and here. All right, now because I know that I made the picture, I shortened the picture so that you could see it. So I know this is going to be my medial side, so this is going to be my medial condyle, and this is going to be my lateral condyle, because I find the head and I just kind of photoshopped it. And so this will be my medial side here and my lateral side here. And I know that too because I'm looking at that large depression that tells me I'm on the back side of the bone. There's no depression here, so I'm looking at the front side. Okay. All right, so the next bones are going to be the ones that make up your lower leg, and it's two big bones. One's called the tibia, and one is the fibula. And the tibia is the weight-bearing bone. Okay, the fibula is more of a support bone. So the tibia is your larger of the two bones. It's your weight-bearing bone, and the femur lies right on top of it in a line. So all your weight is taken from your pelvic cavity or pelvis to your femur to your tibia. The medial bone, that's your tibia. So the tibia is the medial bone, and the fibula is the lateral bone. Now, a lot of people want to say fibia and tibia or fibula and tibula. They want to put an LA on both of them or take away the LA completely. It's tibia, fibula, and if you could tell a fib, you tell a lie. So put your fibula, and maybe that'll help you remember fibula. Okay, so fibula and tibia. Again, you need to know if you're looking at the medial or lateral side, well, the fibula is always the lateral bone, okay, and since the tibia is always the medial bone, that allows you to look at the distal end and figure out what you're looking at if you're on the medial or distal side, or medial or lateral side, I'm sorry. So looking at the distal end, where the fibula and tibia come together, the fibula hangs down a little bit lower, and we call that the lateral malleolus. That's your lateral ankle bone. Okay, so if you feel down at your ankle and you've got those two knotty places on either side of your ankle, you call those your ankle bones. That's actually your lateral malleolus. On the inside of your ankle, that quote-unquote ankle bone, that is your medial malleolus. Okay. At the top, if you feel just below your knee, kind of at the top of your shin, you'll feel a bump. That's your tibial tuberosity. Where your femur is going to articulate, you have your lateral side and then your medial side here. You also have these two bones are connected by interosseous membrane. So they're a little bit flexible, they move a little bit, but again, the fibula is really there to support the tibia and help stabilize that bone. So your tibia is your stronger of the two bones. It's also kind of triangular in shape, so if you were to look down at the bone, you would see what we call your shin. It's the front of the tibia, and it's really sharp. It's got a real, it would be this part of the triangle, so it's kind of a sharp bone. This is looking at it from the back, and so here would be your lateral malleolus, your medial malleolus, and then you have your articular surfaces here, your medial condyle, your lateral condyle again. So remember, think about these bones if you're looking at them from the front or the back. If you don't see a tibial tuberosity, that's a big clue that you're looking at the back side of it. So look for that landmark, and that will tell you if you're looking at it from the front side or the back side, which will help you figure out if you're on the medial or lateral side. Okay. Here's just a close-up view, a knotty place. That's your tibial tuberosity. Here I have a posterior view to show you again these condyles here and here. So use your textbook. That will allow you to see more pictures, and also your practice anatomy lab will give you even more practice identifying the bones and their features. All right, so showing you how this articulates, I want to show you those ankle bones. This will be your medial malleolus here and your lateral malleolus here. So you can see how the tibia, the weight comes from the femur down to the tibia and then right on to the top of the foot. So all the weight is being carried this way. And again, the fibula is really there just for stabilization. All right, so that's how you form the ankle joint. All right, so I want to talk about the ankle joint, and when you look at this particular picture, we've got a side view, and we've got this is from the side, and then we're looking at it from the front. And so just as when you're looking at it from the side, you have this large bone here that is what we would know as our heel bone, and I'm going to give you a real term for that in just a second called the calcaneus. And you have another bone just above it here called the talus. And so the tibia fits right on top of the talus to form your ankle joint. So your tibia is going to lie directly on top of a bone here called the talus, and then you're going to put all your weight on your heel bone or your calcaneus. All right, so let me show you what that looks like. So this is the foot, and so your bones that make up the heel and then the main part of the foot, these are all called your tarsals. So just like your carpals kind of made up your wrist part of your hand, all of these little bones here, 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 all of these bones are your tarsal bones, okay? The only ones you have to be able to name are the talus and the calcaneus, okay? So the talus is where the tibia, how it lines up, and the calcaneus again would be your heel bone. You do not have to name all your other tarsal bones for your lab test, okay? So I'll say name this group of bones, you'll say tarsal, or I may ask you specifically the calcaneus or the talus. Those are the only two specifics you have to know. Now, just as in the hand, the next set of bones that are more distal are your metatarsals. So instead of being metacarpals, okay, you have metatarsals, and this makes up the where your arches are. This kind of makes up the part of your foot, including the ball of your foot. And then just distal to that, you have your phalanges, and they're named just like your fingers. Your big toe is number 1, 2, 3, 4, 5. Okay, so if I wanted you to name this bone, this would be metatarsal number 2. Okay, if I wanted you to name this bone, that would be the number 2, 1, 2, 3. You're in your middle phalanx. Okay, phalanx. All right, so again, just name them just like you did your fingers. The big toe has a proximal and a distal. All the others have a proximal, middle, and distal. Okay, and you can see in your textbook more information about how to name that. And also, Miss Graham will give you even more information. So the last thing I wanted to talk about, when we think about these bones, remember, it can be from any view. So you may see it be from the top, like this view, or it could be from the side. So you also need to recognize, again, the calcaneus, the talus. These are all tarsal bones, okay? These would be your metatarsals, and then this would be your toes or your phalanges. All right, so make sure you recognize these structures not only from the top, but also from the side. And this is an actual skeleton. You can see your calcaneus, your talus, all of these being tarsals, all of these, 1, 2, 3, 4, 5 metatarsals, and then these would be your toes or your phalanges. All right, so again, just practice looking at the skeleton and identifying the bones. And the last thing I want to talk about are the arches. And so the arches are made as you learn to walk, and as your muscles start to pull on these bones, it kind of you start to use the muscles in your leg and in your feet to balance. It starts to pull these bones and kind of shape the foot into forming these arches. And so you have an arch along the outside called the lateral longitudinal arch. You have a arch along the inside called the medial longitudinal arch, and you have one that goes across the foot called the transverse arch. And so if you make footprints in the sand, so if you look at someone's foot and you kind of see that they've made a footprint, so that would be where our arches are. Okay, and those are developmental. You develop those as you learn to walk, and the muscles and ligaments and tendons start to pull on these bones and shape those arches. All right, that's all there is to the lab video. So again, watch these videos, watch Miss Graham's videos, go into the study area of your mastering and look in the textbook, and you should do just fine. Thank you.